personal. We just want to make sure we keep everyone on time, okay? So for tonight, we have 5 programs, as I mentioned. So we're going to be, our opener is going to be Albany, followed by University of Pennsylvania. Next is Metro Health, our Case Western, followed by VCU, and then last but certainly not least, Eastern Virginia. So with that, I'm going to turn it over to Albany to lead us off.
Thank you so much for having us. I'm going to share my screen now. Working?
Oh, yep, there you go.
Perfect. So my name's Sophie Sherrill. I'm a PGY4 at Albany Medical Center, one of the chief residents. I'm excited to tell you guys about our program. We're located in Albany, New York, the state capital, in beautiful upstate New York, and let's get started. So we're gonna do a presentation about 10 minutes and then leave 10 minutes for Q&A. So who are we? These are our primary faculty that we work with. In the center is Dr. Hush, she's our program director. We spend a lot of time with all these attendings during our 3 years in the program. The other faculty in the area are very active in our education. We have Sunnyview Hospital, I'll tell you a little more about that soon, but lots of attendings there. The VA, many in the community that are eager to teach us, as well as piano instructors in the area. These are our current residents. We're a categorical program, so the PGY1s are involved with our medicine department, and then PGYs 2, 3, and 4 are our rehab residents. It's a small program. It's my favorite aspect of the program, actually. Keeps a very tight-knit community, great environment for learning. So I love that about our program. I think we're the smallest in the country. So Albany Medical Center is where we spend the majority of our clinical time. It's a large hospital, 734-bed hospital. It's the largest physician's practice in the region, so over 450 doctors. And we have Albany Medical College attached to our medical center, which is great. We also work at other outpatient sites, Clifton Park office as well. That's where we do our ultrasound curriculum, and the Center for Disability Services. We also spend the majority of our inpatient time at Sunnyview Rehab Hospital, which is a great standalone rehab hospital. This is a snapshot of our salaries and benefits. I can tell you that the salary goes a very long way here in Albany, so we're happy residents. There's a lot of other things that the hospital provides to us, which are great perks as well, listed here. Just to give you guys an overview of our program. It's, as I said, it's a 4-year categorical program. The first year is internal medicine, though we do allow, I think it's a month of PM&R elective time, so that's pretty nice for the PGY1s. PGY 2 year, you have 10 months inpatient, and then 1 month outpatient, and 1 month consult subspecialty rehab. PGY 3 is mainly outpatient, so you start ultrasound, spine, PNO, EMG, you do a 2 months of consult service, and then there's even elective time early on. There's also 2 months of inpatient at Sunnyview Hospital. PGY 4 is all outpatient unless you choose to do an elective and inpatient, and it's sort of a chance to do everything over from PGY 3 year plus some more elective time, which is great. Our call schedule, I have to say, is wonderful. 11, 9, and 6 as weeks per year. So you start on a Thursday, you're on call until Wednesday, and then you're only on home call throughout the week. So meaning you get outpatient calls occasionally, and then on the weekends you do a shift at Sunnyview. There's no 24s, you're not covering the inpatient unit at home. And you do 1 holiday per year, so 6 major holidays, 5 are off, which is great. Sunnyview is, like I said, where we do our inpatient time. So it's a large 115-bed hospital, standalone rehab hospital. It's the only nationally recognized specialty rehab hospital in upstate New York, CARF accredited for brain injury, amputation, and stroke. It's a center of excellence. They have a lot of great technology here. So you'll see exoskeletons walking the halls when you're going to the floor. There's also an inpatient peds program. So that's good to have. And then the other part of inpatient that you'll see is that Albany Medical Center itself. So that's located within the building, and there's 20-bed rehab unit up there. And we'll see about 300 to 400 patients cycle through per year. And We Round is a consult service, so it gives you training for the different consult experience. And You Round is basically in the gym, see how the patients are doing, triage any problems, and the medicine team takes care of all the primary issues. So in terms of our training, we really like to get as many procedures in as we can. Electrodiagnostics during PGY3 and PGY4, we try to get about over 300 if we can. We also have opportunities to go to the prison, which we love, and then working with whoever in the community will have us also. There's neurology and other private practices. So we do get a lot of experience, and there's over 4 board certified electrodiagnosticians at Albany Med for us. Same thing with chemo denervation. We probably all do at least 300 during residency on adults and many pediatric patients. We're trained in EMG as well as ultrasound guidance, and we do these outpatient clinic, but also in the OR. So ultrasound, so we have a longitudinal ultrasound curriculum throughout the year, and we focus on different joints one at a time, and then we review the anatomy, we go over scanning techniques, and then we practice on standardized patients, which is a great experience. And this is all led by our attending Dr. Miller. And then in clinic, you also get to practice diagnostic ultrasounds and injections as well. And then also with our didactic ultrasound curriculum, we get to do cadaver lab injections. So there's that extra layer of training and time to explore anything that is tricky or difficult. Then the Spine Center is another great new feature of Albany Med. It's actually a brand new building across the street, and our attending Dr. Narayan actually works there, and she does interventional pain management for spine and non-spine conditions. And we do injections at a surgery center about 5 minutes away. So didactics, we have a protected didactic time scheduled every week, Wednesday from 1 to 4 o'clock. This is led by attendings, and then we try to cover all of Bradham in 12 months. And there's a lot of different presentations, journal clubs, grand rounds. Each resident has a chance to present different topics. And I love our didactic schedule because since we're a small program, everyone's super present and involved in learning, and it's really effective. So we have the Patient Safety and Clinical Competency Center, which is a great resource to help simulate clinical training. We're in there pretty frequently. We do our ultrasound practice on standardized patients there. We have mock oral exams there, and we also have standardized cases throughout the year. So some extras. We get $750 of educational money every year. We get to go to the board review course. We do a PM&R meeting as well, and our library is really has everything you could ask for, and if you don't have it, they'll get it for you. We have a lot of different research projects going on right now. These are the 4 main ones that I think different people are working on, 2 of which are at Sunnyview, and one of them is really interesting on gait training for stroke patients. So if you want to do research, it's available. There's a lot of different departments that you could get involved with, and pretty much anything you're interested in, you could get started on a project. In terms of opportunities after residency, half of the people go into general PM&R, and then I would say about half do fellowship, ACGME accredited and non-accredited fellowships. And then here at Albany Med, we have the ACGME accredited multidisciplinary pain fellowship, which is great. So that's an overview of our program. Happy to answer any questions. I'm a really happy resident there. I also have Yasser in the audience there. He's a PGY3, so he can also answer any questions you have for us. How do I fix it?
So it looks like you got a couple of questions rolling in. One is, it says, "Hi, thanks for an awesome presentation. What is it like living in Albany?"
So I went to medical school here, so I've been here a long time. Pretty much anything you want to do, you can do here, but I think the main draw to the area is the outdoors nearby. Obviously, every city is about 2 to 3 hours away, like Boston, New York, I guess Syracuse. But the great thing I think is there's tons of lakes and parks, and like there's the 46 peaks, so there's just tons to do, especially in the summer. Yasser, you have anything to add to that one?
Hi everyone, Yasser, one of the third years here at Albany Med. So Albany is a great place to live, great place to train, super affordable. Our salary definitely does go a long way in terms of living. You know, I'm from North Jersey, and moving to Albany feels just like home. There isn't anything major that I feel like I'm missing out on. Great outdoor place, kind of like Sophie mentioned, a lot of great outdoor activities to do, a lot of great winter activities. If you're into skiing, snowboarding, etc. You know, fall's coming up, every farm and every pickable fruit, vegetable, thing of that sort, really big in this area as well. A lot of farmers markets, things of that sort. So solid place to live, solid place to train.
And very affordable, like he said. What's the next question?
Next one is from Michael Bird. Thanks for the presentation, Dr. Sherrill. What is the commute like?
So I'm looking at Albany Med right now from my window, so I can walk across the street. It's 4 minutes door to door for me, but there's also plenty of places to live in the area that are, you know, 10 to 20 minutes away. And there's lots of small little cities like Troy and places like that. In terms of other sites, Albany Med and Sunnyview Rehab Hospital, about a little over 25 minutes apart. So it would be nice to live somewhere in between. There's the Clifton Park office is about 25 minutes from here as well, maybe a little less. So nothing too bad. And I have to say, I never see traffic, so that's pretty nice.
Yeah, so I live in the midpoint between Albany Med and Sunnyview. It's about 15, 20 minutes in each direction. Moving up from Northern Jersey, you know, the worst traffic I've ever seen probably added 3 minutes to my commute, where I'm used to adding an hour to my commute. So commuting is not an issue, and most people kind of live in between all the sites, and you're usually driving 15 to 20 minutes at most to any of the sites that you need to be at.
Your next question is from Paul. He says, that all sounds fantastic. Thank you. What opportunities are available for residents interested in medical education?
So we're attached to Albany Medical Center, so there's a lot of opportunities. One of our faculty actually works very closely with the medical college, teaching them their neuroscience theme too. But we always have medical students coming through, and we're connected with the administration there as well. So there's a lot of opportunity, but go ahead, Yasser.
Definitely. So, you know, we're an academic center connected to a medical school. So medical students do rotate with us. The PA program is also involved with us. So there's a lot of work between us and the medical school. We do get a lot of students who don't have a PM&R program at their school, so they get the opportunity to come and rotate through with us as well. And a ton of research opportunities. So Sunnyview Rehab is a standalone rehab hospital located in Schenectady. And we actually just started doing our inpatient rehab rotations there recently. And they have a ton of technology, and they've been collecting data for years and years, but the therapists were collecting and they weren't doing much with it. When we started over there, we pretty much were given all this data. So there's a ton of research to come up with. And the 2 residents that were there were actually able to both publish posters and get them accepted to PM&R this year pretty quickly once they started. So a ton of opportunity.
Your next question and comment is from Rosalind. Thank you for the great presentation. Are there any community outreach opportunities or global health opportunities?
So in terms of the community, we work at the Center for Disability, so we see a lot of people from the greater community there. And I know there are, you know, we haven't gotten, one of our goals was to get involved with athletics and rehab in the area, but we haven't yet done that. Do you have anything else on the community specifically?
Like Sophie mentioned, the Center for Disabilities, through our sports medicine office, which we have the opportunity to rotate with, they do cover some of the local universities, U Albany sports, Siena College's sports. So if you're really interested in kind of pursuing those opportunities, you know, you're more than welcome to. One of the attendings there covers one of the local boxing organizations, and we do all the physicals for the kids that are involved in the boxing group over there. And in terms of global health opportunities, you know, we get a decent amount of elective time, and as long as you can tailor it to be something educational, something approved by administration, there pretty much is no limit. I don't recall anyone recently doing anything global health related in their training, but if they decide to do that and can prove that it is academic, I'm pretty sure you're able to do that.
Awesome. Just to give you guys a heads up, you have about 5 minutes. Next question is by Locke. Thank you for the presentation. How has the program handled the COVID-19 situation?
So I feel like Albany Medical Center handled it super well. We had presentations almost daily about what the institution was doing to protect us and take care of the community. Within PM&R, our program, we took care of COVID patients, but only in a rehab setting. And fortunately, it hasn't been a problem lately, and I think it was handled very well. The patients, the students on electives were primarily kept at home for about a month, if possible. So I think half of the program was home and half were working, but I can tell you that we all felt very safe and protected, and our program director checked in with us, and fortunately our area wasn't hit as hard as others. So
our program director is definitely very supportive of us. And, you know, from day one, she specified if anyone feels they are sick, that they have been exposed, that there is any risk or issue, you stay home, you quarantine, this will not be counted against you. And, you know, you're good to go. It was crazy times, and, you know, the hospital had to learn to adapt, but, you know, they were checking temperatures at the door. People were wearing masks. Albany Medical Center is actually the largest academic center outside of New York City. And with everything that was going on in New York City, we became the transfer center for all COVID patients that New York City couldn't handle. So we were lucky that we didn't have a lot of numbers in the region, but a lot of COVID cases did come up from New York City, and they eventually ended up in our rehab, both on the Albany Med rehab and at Sunnyview. So it was kind of cool working with some of those patients after the fact. And, you know, thankfully no one in our program and no one in our program was ever exposed or got sick. I don't know about the rest of the hospital. I'm pretty sure no residents ever got sick the whole time.
Awesome. You guys are have 3 minutes left, so I'm going to kind of pair some of these questions together. So essentially the question is, being that you're such a small program, how's the workload distributed between residents and attendings? And then what is one thing that you'd like to change about the program, and how flexible is the curriculum slash administration accepting of feedback?
So our program is small, but fortunately all the services essentially run without us if we weren't there. You know, there's not always a resident on every service except for our consult service, but all of the attendings are willing to do the work, and they're not counting on us to complete the workload without them. So I think it's very well balanced, especially because it's a small program. You couldn't have a resident on every service at every time, except for the consult service. So that's managed pretty well. And what was the feedback? I think we are I think, like I said, our program's really small, so it's a very tight-knit community, and we're always talking with our program director about anything we want to change. So she's very receptive to feedback, and there's an open communication. Like, everyone is very comfortable speaking with the attendings if they want to change something.
I think the other part is, what is something that you would change about the program, or is there anything you would change about the program?
Anything, Yasser?
You know, our program is pretty solid. We are a very strong outpatient program. Initially, we were very heavy on procedures and definitely got a lot of numbers in. With Sunnyview recently being added, we've kind of taken it to a whole nother level with our inpatient experience. We do have an inpatient PEDS program, but it's, you know, still kind of in the works. So, you know, I think that's one thing I would hope to continue to see to grow and improve and just kind of get a little bit more exposure on the inpatient, but we do definitely make up with it outpatient.
I'm trying to see, you guys have 1 minute left. There was another question that came in about community outreach programs. So I think you had answered that before. If anyone has some last minute questions, go ahead and ask.
I have to say, if there's anything you do want to do, our program director, everyone is super supportive and will help you. So, I mean, if there's something that isn't obvious, like a research project or something that hasn't been tapped into yet, it's fair game. So it's a very supportive environment and everybody you work with wants you to succeed. So I really love it. I'm really happy with my choice.
I couldn't have said it better.
Well, awesome, guys. That takes us to 20 minutes. I'll say perfect timing. Thank you so much. If you guys have any more questions, if you want to put them in the chat, then you guys are happy to stay on and answer them in the chat. So thank you guys so much. You guys did fantastic. I'm next going to turn it over to University of Pennsylvania. The Zoom is all yours.